Tantor Audio, a division of Recorded Books, presents A Good Time to Be Born, How Science and Public Health Gave Children a Future, by Perri Klass, narrated by Randye Kaye. For the first time in my life, I was really up against facts. No student, whether in law or medicine, is living a real life. Here in Boston, submerged in the hectic life of a big clinic, I was abruptly forced to translate what I had studied into actuality, to realize that the luridly colored pictures in ponderous medical texts meant actual fever and pain and delirium and mutilation, and that those crisp summaries of what to do about this or that physical ailment, which had sounded so reassuring on the printed page, were of distressingly little help to an inexperienced beginner. S. Josephine Baker, Fighting for Life. Introduction: The Waning of Child Mortality and the New Expectations of Parenthood. Our grandparents and great-grandparents and all the parents before, throughout history, expected that children would die. It was a known and predictable risk that went along with being a parent. Now we expect children not to die. We are the luckiest parents in history, we who are part of this wave, over the past 75 years or so, because we are the first parents ever who have been able to enter into parenthood in the hopeful expectation of seeing all our children survive and thrive. And we are also the luckiest children in history, born into an era when we could expect to grow up along with all our brothers and sisters. Driving down child mortality in the late 19th and early 20th centuries was in no way a single project, but it can be seen as a unified human accomplishment, maybe even our greatest human accomplishment, at least for pediatricians and parents. The entire world has relearned, with some shock and great sorrow, how vulnerable our precious human bodies are to the microorganisms that find ways to take advantage of how we live, what we eat, how we travel. Parents have taken some comfort in knowing that, for the most part, children have been less severely affected by COVID-19, but all through human history, babies and children have been a particularly vulnerable group, and parents have lived with the fear of contagion, infection, and death. Children used to die regularly and unsurprisingly. Babies died at birth or soon after because they were premature or just weak, because they were born with congenital anomalies, because they got infections. Older infants and one-year-olds died of summer diarrhea, often caused by microbes in the water or in the cow's milk they had started drinking after they had been weaned. 3-year-olds and 4-year-olds and 5 and 6 and 7 and 8-year-olds died of scarlet fever and diphtheria and pneumonia and measles, of skin infections that turned into sepsis, or influenza that turned into pneumonia. As recently as the late 19th and early 20th centuries, almost every family in every ethnic group and every country, rich or poor, was touched in some way by the death of children. Childhood death was always there, in the shadows at the edge of the family landscape, in prayers and religious ceremonies, in the memorial portraits hanging on the wall, in popular sentimental poems and stories and dramas and paintings. Because they figured so consistently in childhood and family life, child deaths also figured in the art and literature and songs and stories of childhood and family life from a century ago, as they had all through human history. "I am a lover of babies, and yet I can't seems to have them," wrote Mrs. W.D. from Brooklyn in 1917. "I am married 11 years last July and would have 6 children, and am about to become a mother again, which I almost fear. I have now but 2 out of 6, one boy 9 years and one 6 years. 2 of them had apparently died some years ago. She didn't say how, But then within a year, she had 2 babies and ended up losing both of them. I gave birth to a beautiful fat boy, and it lived but 3 days. The doctor told her the baby had a leaking heart. 3 months later, she was pregnant again. This son lived to be a year old, and then she awoke one morning and found him dead alongside of me. Now pregnant again, she worried constantly both about the terrible long labor she was likely to endure and about what would become of the baby. I try and live a good, honest life, and my home is my heaven, and babies are my idols. I love them, but I am afraid something will happen to this one again. She was writing this letter to the United States government, to the Children's Bureau, established in 1912. This new federal office had published the pamphlets Prenatal Care, 1913, and Infant Care, 1914, which were immediately and enduringly popular. They were at first distributed free of charge and provided by politicians to their constituents and were later available for purchase. By 1929, the government had estimated that these writings had touched the parents of half the babies born in the United States. Mothers responded eagerly, sending more than 125,000 letters a year to the Bureau with their questions and their stories, including accounts of deaths. "You can think how I feel," Mrs. W.D. wrote to the author of the pamphlets. "I cry night and day for my big fat baby taken from me like that." Mrs. W.D. was not living in the Middle Ages or even in the Victorian era. She was living in 1917 when my grandmother lived, and in New York City where my grandmother lived, 10 years before my own parents were born. In fact, Molly Ladd Taylor, the historian who compiled the collection of mothers' letters to the Children's Bureau, was inspired by finding her own grandmother's letter in the files. Some of the letters came from women in rural areas, beyond easy reach of medical expertise during childbirth, but others, like Mrs. W.D., lived in big cities where they were receiving full medical attention, and their letters are notable for a mix of tragic acceptance and hope for better answers as they searched for government advice or medical wisdom that might change the story going forward. And at that time, in 1917, when Mrs. W.D. wrote her letter, nearly a quarter of the children born alive in the United States died before their 5th birthdays. Just 2 years ago, after 5 years of married life, we became the proud parents of our first baby, a boy, wrote another mother in 1918. 4 months later, we buried our baby. And it was then that I knew how helpless I was when it came to knowing what a mother should know. My baby was sacrificed through mere ignorance. This happened in the capital of Illinois, and money or efforts were not spared to save him. She had been unable to nurse her son, she explained, and he just faded away. Mothers told of deaths related to common everyday issues, like nursing, weaning, and even constipation. Our baby had not had an unaided movement of the bowels for more than a year when he died this June, at the age of 2.5 years, too worn out to cut his last 2 baby teeth, wrote Mrs. F.W. from Michigan, also in 1918. They wrote, in those early decades of the 20th century, with a certain hope for medical solutions, for advice that might protect the next baby, and even with a desire to extend that protection to all babies and children, to join in the larger project the Children's Bureau and its pamphlets represented. "I only wish I could take up the work of promoting baby welfare," wrote the woman who had lost her child in Illinois. Another mother, almost 10 years later in 1926, explaining that her daughter had died at 20 months of age after an operation to correct injuries suffered at birth, pleaded, "So please, try and help others through your department all you can and keep them from making the horrible mistake we made and from the loss of the one whose place can never be filled." And notably, the employees at the Children's Bureau, including Mary Mills West, the author of the infant care pamphlet, answered the letters individually and at some length. They attempted to provide specific information on topics from postnatal depression to breastfeeding and formula preparation. They sympathized with the grief of women who told of having lost children and reassured them that they were not at fault. The mother whose child had died from birth injuries received an answer saying, "We are indeed sorry to hear of your great grief and sympathize with you most deeply," assuring her that no matter what is done, whether a cesarean section or an instrumental labor, there are always a certain number of babies who die from birth injuries. Some of the letters were from women who struggled with written language and spelling, others from the educated and the privileged. There was no segment of society in which children's lives were secure, nor had there ever been. Though the statistical evidence is incomplete, infant and child mortality in both Europe and America was extremely high through the 17th and early 18th centuries, with a third of all children, or in some cases even 40% or more, dying before they outgrew childhood. Child mortality rates, like adult mortality rates, fluctuated with food shortages and with epidemics. Mortality was often higher in cities, where crowded conditions made it easier for diseases to spread, but rural life could be deadly as well. In colonial New England in the early 17th century, one estimate has 60 out of every 100 children dying before the age of 16. For the first 3 centuries of American history, infant death was the central reality of maternal experience, wrote historians Nancy Schramm Dye and Daniel Blake Smith, who examined the diaries and letters of American women from 1750 to 1920. Infant mortality means death before the first birthday, and child mortality usually means death before the 5th birthday. Death from 5 to 14 is a separate category. In the first decade of the 20th century, when my grandmother was growing up, out of every 1,000 live births in the United States, more than 100 babies did not live to their first birthdays, and mortality rates were even higher among the rural poor, immigrants, and African Americans. By comparison, the infant mortality rate for the United States in 2017 was 5.8 deaths per 1,000 live births. The majority of these deaths before the first birthday actually occur in the first months of life, and most are due either to congenital anomalies, serious birth defects, or to prematurity. Now we are trying to get the infant mortality numbers down from 5.8 out of every 1,000 live births to between 2 and 3 out of every 1,000 live births, the best numbers achieved in some developed countries, such as Singapore, Finland, Japan, and Iceland, 2 deaths per 1,000 live births in 2017. Compiling these statistics was a relatively new idea in the late 19th century, but infant mortality rates are now used as an indicator of the general health and the social welfare systems of a country, probably the most prominent public health scorecard we have. A Good Time to Be Born tells the story of one of our greatest human achievements, a remarkable fusion of science and public health and medicine that transformed our families, our emotional landscapes, and even our souls. All through human history, many babies died at birth, and many children died in infancy and childhood. This was true through the Middle Ages and the Renaissance, true in colonial America and in Victorian England, and it was still true in the early 20th century. If you went around any table, pretty much everyone would have lost a sibling in childhood, lost a friend to death at a young age, lost a child. Infant and child mortality was a fact of life for almost every family, rich or poor. John D. Rockefeller, the richest man in the world, founded the Rockefeller Institute when his grandson died of scarlet fever, though mortality was higher among 19th-century disadvantaged populations, including enslaved children and the urban immigrant poor. Poverty, privilege, and race affected and continue to affect childhood mortality in many ways. Richer children were in better shape nutritionally to begin with, and they were more likely to have access to better water and milk. Wealthy children and white children were more likely to get medical attention if they did get sick, but before antibiotics were available to fight infections, before rehydration techniques to counteract the deadly dehydration of diarrhea, there was only a limited amount that medical attention, however expert and expensive, could do. The children of physicians in the United States at the turn of the century had only marginally lower mortality rates than those of the population as a whole. Throughout the 18th and 19th centuries and on into the 20th, no wealthy family was untouched by childhood death. Tycoons and presidents called in the best doctors in the country, and their children still died. The nation is full of institutions founded by parents bereft of descendants to whom they could leave their fortunes, parents whose great wealth had not saved their sick children. Wellesley College was established in 1875 on 500 acres outside Boston, bought by Henry Fowle Durant. Originally intended as a country estate where Durant and his wife Pauline planned to build a pleasure palace for their gifted young son. But the boy died of diphtheria at the age of 8, and so his pleasure palace became a college for women. Stanford University was founded by Leland and Jane Stanford in memory of their only child, Leland Jr., who died at 15 of typhoid fever in Florence in 1884 on a luxurious grand tour. By the time I was training in pediatrics in the 1980s, there was no such thing as routine or unavoidable infant and child mortality. Short of very rare and terrible diseases, almost every death was supposed to be preventable and prevented. The vaccines of the 1950s and 1960s, polio, measles, were augmented with new vaccines to prevent diseases that were deadly but much rarer, such as the life-threatening infections caused by Haemophilus influenzae type B, and advances in neonatology had made it possible to save sick newborns who didn't breathe promptly in the delivery room and to keep tiny premature infants alive. We would go through our medical training without ever seeing a case of diphtheria or polio. Those battles had been won. Instead, we would set our sights on eliminating SIDS, on making sure infants were properly strapped into car seats. Pediatric oncology offered a 90% cure rate even on the scariest ward. Pediatric cardiology could save all but the most severe congenital heart defects. There were still battles to be won, but we had begun to see a world our grandmothers could not even have imagined, in which there was an implicit promise that if parents took the right precautions, every child could be expected to live to grow up. It was our obligation as pediatricians to help make the world even safer. Childhood deaths represented precautions not properly taken, treatments not properly applied, medical problems needing to be solved as quickly as possible. This change in outlook represented a great tectonic shift in parenting, doctoring, and family life. Childhood death had always been part of the substance of loving children and living with children. The certainty that not all children would survive meant an imperative toward larger families and more frequent pregnancies for women when childbirth carried risks of its own. We look back across a divide at a lost historical world in which great poets wrote of the sorrow of losing children, Longfellow, Emerson, and bad poets wrote sentimental obituary verses to order to comfort grieving parents. Graveyards were full of tiny markers, Novelists from Charles Dickens to Mark Twain to Harriet Beecher Stowe used childhood deaths to wring their readers' hearts and to make political and social arguments. But they also wrote those scenes because they had lived those scenes. They all lost children because almost everyone lost children. As Charles Dickens wrote to his wife when their baby daughter died, we never can expect to be exempt, as to our many children, from the afflictions of other parents. It was no single project that took us from a time when no parent could expect to be exempt to a time when all parents expect all children to grow up, when childhood death appears as the terrible exception. The 2003 Institute of Medicine Manual, When Children Die, begins with the statement, "Although dying is a part of life, a child's death, in a very real sense, is unnatural." Childhood deaths seem unnatural today because they are rare and shocking events that we believe should be completely preventable. The manual goes on to say that the death of a child is a special sorrow, a lifelong loss for surviving mothers, fathers, brothers, sisters, grandparents, and other family members. The conquest of infant and child mortality was a collective endeavor, pulling together public health and basic science. Cities tackled sanitation and clean water, and bacteriology and virology teased out the underlying mechanisms of the infections that killed children. There was progress in nutrition and in pharmacology, in medical care and technology. There were Nobel Prize-winning feats of laboratory ingenuity. There were public health programs in urban tenements with visiting nurses going door to door. There were milk stations to distribute clean milk to poor families, campaigns to encourage breastfeeding, and coordinated efforts to educate mothers about how to keep their babies safe. And, of course, there were parents, sometimes grieving parents, looking for answers, requesting help, and demanding change. Now, in response to the COVID-19 pandemic, we have witnessed another collective scientific, medical, and social endeavor, moving at a faster speed and using new and innovative ways of connecting, from scientific researchers and doctors conducting accelerated clinical trials to frontline practitioners communicating on social media hard-won advice gleaned from caring for patients sick with a new disease. The times we have all been living through should help us appreciate the last century's collective endeavor on behalf of children, as we think with new appreciation about the value of epidemiology, as we look with profound hope and gratitude to the scientific and intellectual innovations of microbiology and pharmacology and engineering, as we offer profound appreciation to frontline nurses, physicians, and everyone else who assumes personal risk in caring for the sick in a time of pandemic. These were the disciplines that contributed to the work of reducing infant and child mortality, working and communicating more slowly in the era before the Internet, but linked around the world by the enterprise of keeping children alive. These were the people who counted the number of babies born, recorded sickness and death, figured out what caused mysterious symptoms, pushed for practical hygienic measures in the home and education for parents, and researched therapies to cure diseases and vaccines to prevent them. Over time, these scientists, public health workers, doctors and nurses, epidemiologists, and advocates collectively created a world in which parents could expect that their children would live to grow up. A Good Time to Be Born tells the story of this heroic collective endeavor, this combination of scientific discovery and public health mobilization that has made the world so much safer for our children. As a pediatrician, I feel a special sense of identification with some of the heroic early women doctors, Rebecca Crumpler, Mary Putnam Jacoby, Alice Hamilton, Josephine Baker, who brought new perspectives and energy to the project of taking care of women and children, and with the frontline public health nurses who carried the message that, even in the cruel summer in New York City tenements, mothers could take precautions and effectively protect their infants. The deadly summer diarrhea did not have to be accepted as inevitable, but could be prevented by breastfeeding and good hygiene. As Josephine Baker put it, heat did not necessarily kill babies. In previous centuries, no matter how rich and powerful parents were, no matter how many important doctors they could summon, they had a very limited ability to protect the children they loved. Today's routine immunizations mean that a sore throat cannot represent diphtheria. That's what killed baby Ruth Cleveland, the 12-year-old daughter of former President Grover Cleveland in 1904. When today's children do get infections, they can be treated with antibiotics. There were no antibiotics to treat 16-year-old Calvin Coolidge Jr. in 1924 when he developed a blister on his toe after playing tennis on the White House lawn without wearing socks, and he died of a blood infection. There's a medical understanding now that makes it routine to provide lots of fluid to children with diarrhea so that they don't die of dehydration, as perhaps did 11-year-old Willie Lincoln after contracting typhoid from contaminated water in the White House. And we regularly mark our progress in neonatology by invoking a much more recent White House pediatric death, that of Patrick Bouvier Kennedy, the only child born in the 20th century to a sitting president, who was born 5.5 weeks premature in 1963 and died at the age of 39 hours of premature lung disease at Boston Children's Hospital because there was no way to ventilate a premature infant. A Good Time to Be Born brings together this complex history, the stories of diseases that once terrified parents and terrorized families, the stories of parents, rich and poor, who did everything they could to keep their children alive, the stories of artists and writers who left records of children they had loved and lost. The book traces the discoveries of bacteriology and virology that elucidated the most terrifying diseases, and the scientific advances that made it possible to fight back in powerful ways that had never before been remotely within reach. The perspectives of medical humanities, art, literature, and letters from the late 19th and early 20th centuries are brought together with science and clinical medicine to give a sense of how the reality of childhood mortality colored the world, how it figured in the lives of parents, doctors, politicians, artists, scientists, and activists, how parents at every level of every society grappled with the tragedy of losing children and what it meant that this tragedy was both commonplace and inevitable. Even when these deaths were common, parents mourned and grieved with the same strong mix of emotions we feel today. And through history, many adult lives were shaped forever by that grief. Parents today know, of course, that there are no guarantees, and we have all been most dramatically reminded of the power and reach of infectious disease by the 2019 coronavirus, as we were 4 decades ago by HIV and by other infections such as Ebola, SARS, and H1N1. Still, we also know that the standard childhood infections, the one everyone gets or used to get, as well as the rarer but potentially deadly ones, can be either prevented or treated. Experts tell us how to keep our babies safe from day one: rear-facing baby car seats starting with the ride home from the hospital, sleeping position on the back to avoid SIDS, smoke detectors, carbon monoxide detectors, window guards to keep a small child from falling out. There are laws to regulate the sale of window blind cords so that children don't strangle, and to dictate how caps fit on medicine bottles so children don't poison themselves. These policy victories make it all the more striking that we have not succeeded in regulating guns or in applying technologies that might make them less accessible or less dangerous to the young, since guns remain a tragically significant cause of death in children through accidents, suicides, and homicides. Racial disparities in maternal and infant mortality persist.
Sample complete. Ready to continue?